Why we need more cannabis medicines. The Pain Clinic, THC versus CBD, Medical Cannabis, Access, European Pain Federation, position paper on appropriate use of cannabis-based. Do different cannabis strains cause different effects? Medical Cannabis in pharmacies in Malta. Medical Director, MD, Masters of Science, PGC. From Malta, Dr. Andrew Agius.
Hello, everyone. And first of all, I would like to thank the organizers for inviting me to speak at this online conference. My name is Dr. Andrew Agius. I manage a pain clinic in Malta. And today I'm going to be talking about why we need more cannabis medicines. So just to give you a bit of a history, I started working as a doctor in 2003. And until 2015, I was a full-time family doctor. And I had an interest in certain conditions which did not respond to medication. Mostly, I was interested in the chronic pain conditions such as fibromyalgia, chronic fatigue, depression, and also the symptoms associated with them, which could not really be managed well. At the time, I couldn't explain most of the symptoms that I was seeing in these patients, and most patients did not respond to pharmaceutical medications very well. However, they seemed to respond to certain lifestyle changes, and that is when we decided to set up this pain clinic. So in 2015, together with an anesthetist and a physiotherapist, we set up a one-stop shop to help patients with chronic pain and illnesses which didn't respond to conventional medication. We offered them physiotherapy, exercise, prescription, meditation, yoga, and certain lifestyle changes which help them improve their quality of life. Unfortunately, there wasn't really a quick fix that helped patients make that huge improvement. So we tried to look into the status of medical cannabis, which we knew helped in certain painful conditions. And in 2015, we only had one product that could be prescribed. And this could only be prescribed by certain specialists who were not ready to prescribe a product that they didn't know much about. And it was in 2016 when the first patients came to the clinic to talk to me about their experience with cannabis as medicine. And that is when I started interesting myself in learning more about the endocannabinoid system, which was a very important piece of knowledge which was missing from the medical curriculum. And it unlocked many of the answers that I didn't know how to explain until that time. So what is chronic pain? Chronic pain is a condition that is very common. 1 in 5 persons suffer from chronic pain in Europe and also in Malta. It is pain that persists for more than 3 months or more than the expected time of healing. Very often this pain develops over months and years, and it doesn't reflect tissue damage because most patients with these conditions get investigated thoroughly, and yet their blood results, their x-rays, their MRIs are always normal. So what happens in chronic pain? There is central hypersensitivity because all of the pain signals going on inside the person's nervous system cause overactivity of the nervous system, and this results in the patient becoming sensitive to pain. There is a spectrum of severity, with fibromyalgia being a term to describe a severe form of this chronic pain condition. The symptoms associated with chronic pain are burning, tingling, numbness, and actual pain in the muscles, in the bones, deep pain. It's also associated with cramps in the muscles, anxiety, depression, and various other syndromes which we couldn't really explain, such as temporomandibular joint syndrome, restless leg syndrome. When I found out about how the endocannabinoid system actually works, I could explain many of these symptoms, because they are caused by loss of homeostasis in the body. So to understand a bit about the endocannabinoid system, here I prepared a slide to show a bit of the functions where it is involved. As we see, there are many unrelated functions in the body, such as mood, appetite, memory, pain control, stress management, which are all controlled by the endocannabinoid system. And the function of the endocannabinoid system is to keep everything working in normal balance, in what we know, what we describe as the Goldilocks zone. So it keeps neurotransmitters in their normal levels, it restores balance in metabolic disorders, protects against inflammation, and it's also very much involved in the stress response in the body. And as we can understand, when the body is exposed to chronic or severe stress, one can have damage to the endocannabinoid system. However, most patients with chronic pain always have a family history. This condition where there is a defect in the endocannabinoid system is very often inherited, and patients usually have a family history of fibromyalgia, OCD, or another mental health illness. Throughout their lives, they would be exposed to stress. Sometimes it's severe stress or possibly a traumatic event, which can also cause this dysfunction in the endocannabinoid system. Chronic stress, physical trauma such as a motor vehicle accident or a fall from height, and also viral infection. So this is a true condition where we see that the endocannabinoid system becomes dysfunctional. And as a result, because of the extensive involvement of the endocannabinoid system, we get various symptoms which Ethan Russo described as clinical endocannabinoid deficiency. And most of these conditions we couldn't really explain. So when it comes to treating these conditions, which are very often associated with chronic widespread pain, migraines, back pains, pelvic pain, restless legs, attention deficit, all these conditions are very often associated with each other. They very often coincide in the same patients. And we need to target the endocannabinoid system with certain medicines to help it restore normal function. So what are we going to prescribe? What medicines work best? Does CBD only work in these cases? So my first patient, who had been a patient of mine for more than 10 years, I was her family doctor. I had referred her to rheumatologists, to psychiatrists, to pain specialists, but no one could really understand and manage her symptoms well. She was on a variety of antidepressants and anti-epileptics to reduce her pain, depression, anxiety, and was unable to cope with her daily activities. And when she tried CBD oil on its own, it seemed to have a therapeutic effect that all other medications in the past didn't really help. She started with a few drops of CBD oil, which eventually were tailed up until her symptoms were better controlled. And this preparation of CBD helped her relieve her symptoms. However, not all patients respond to CBD. As we see from this very busy slide, these are just a few of the ways where CBD interacts with the receptors in our body. It is not a direct agonist of the cannabinoid receptors. It works more by preventing reuptake of the endocannabinoids and by helping the neurotransmitters restore normal levels. However, CBD alone is not always sufficient when we are managing patients with severe endocannabinoid dysfunction. So, as we mentioned, CBD can enhance the levels of endocannabinoids, such as, for example, anandamide, which is the body's natural endocannabinoid that we produce ourselves. However, when there are symptoms of endocannabinoid deficiency, CBD has a limited effect. So very usually what we observe is that we have a short-lived therapeutic response, and then eventually the CBD does not continue working, and the patients would get a recurrence of their symptoms. However, when we introduce THC, we find that the patients get a very good therapeutic response, and most patients respond very well to a combination of CBD and THC. As we know, THC is a controlled drug, so we need to prescribe it with caution. We need to take a proper history, see if there are any contraindications, and monitor the patient closely for any side effects that might arise. In Malta, THC can be prescribed only after the prescription is approved by the Superintendent of Public Health, and only as an alternative to medication that has been already tried in the past. So what is THC? THC stands for tetrahydrocannabinol. It is the intoxicating compound in cannabis that recreational users seek. It mimics anandamide in structure and also in mode of action. It attaches directly to the CB1 receptors in the brain, in the endocannabinoid system, and modifies their action, and it affects various functions that we saw in a previous slide that the endocannabinoid system controls, including thought, memory, pleasure, movement, pain, time, perception. And in this way, by targeting the endocannabinoid system, we can use THC therapeutically to manage various conditions that involve dysfunction in the endocannabinoid system, including fibromyalgia. As we saw, it is one of the classic manifestations of endocannabinoid deficiency, as described by Professor Ethan Russo. PTSD, depression, anxiety, restless legs, temporomandibular joint syndrome, eating disorders, and all these different conditions that could arise from loss of homeostasis. THC is a very useful and a very effective tool. However, it is not without side effects. It should be prescribed with caution, and the most common side effects we see are usually a bit of a cough until the patient learns how to vaporize it properly if they're using that method of delivery, possibly increased anxiety. So in that case, we advise to increase the CBD levels and have a balanced effect with less anxiety. Increased appetite, which is very often one of the symptoms, one of the effects that we look for as well. Short-term memory loss, dizziness, poor coordination, psychosis in a very small percentage of the population. It is also a risk, and that is why a detailed history is important before prescribing. Hypomania in cases where the patient could have a history of bipolar disorder, and that is why it's contraindicated, and possible dependence on the drug. While we have these negative side effects of THC, it's very important to also observe that since the THC acts directly on the endocannabinoid system, we see an improvement in other conditions where the endocannabinoid system could be causing the pathology. So, for example, patients who are prescribed medical cannabis with a combination of CBD and THC get improvements in skin conditions such as eczema and psoriasis. They get improvement in allergic conditions such as hay fever and also asthma. They get improvement in metabolic disorders such as diabetes and hypothyroidism. They get improvement in their gastrointestinal functions. They get stronger immune systems, and patients on medical cannabis get over common colds and infections very quickly. And also they have side effects which we usually target, so better sleep, less fatigue, better focus, and an improved, more stable mood. Before prescribing THC, one needs to see if there are contraindications such as schizophrenia, psychosis, or hypersensitivity, as well as a family history of psychotic illness. There are various preparations in which THC can be administered, including the dried flowers or buds, which are available in Malta. We have 4 products available in the pharmacies: oils and tinctures, edibles, concentrates, various sprays, topicals, and also vape pens and capsules. But why is it important to have all these different preparations? Why can't we have one preparation, for example, one strain, one medicine, and the patient will remain on this medicine throughout and continue to control their symptoms with this medicine? Well, what we know is that the different preparations have different modes of delivery, different modes of action, and obviously they work for different time intervals. So, for example, drops would work for 6 to 8 hours, vaporizing would work for 3 to 4 hours, and capsules and edibles would work for even longer. Now, in Malta, the law has changed. All doctors can prescribe, all pharmacies can dispense, and patients can actually access their medicine at a relatively high price. However, we still only have 4 products available, and the problem is that because patients use the same products for a long time, we end up getting tolerance, and the efficacy does not remain as it was in the initial phase of treatment. So what we need is different strains, different varieties, and different medicinal preparations to help the patient maintain a consistent therapeutic response. So as we know, recreational consumers of cannabis flower claim that different strains have different effects. We know that sativas tend to cause an uplifting effect, indicas tend to cause a sedating effect and sleep-inducing effect, and hybrids perhaps have a bit of both. We know that the different strains are not dependent on the cannabinoid content, on the THC and CBD percentages, but on the terpene profiles in the different strains. CBD helps to reduce side effects of THC and at the same time enhances the therapeutic effect. However, no strain, no gain, meaning that if we don't have different strains of cannabinoids, of cannabis flowers, we will not have the consistent therapeutic effect that we need to keep patients well controlled and to keep them having the same therapeutic effect. So we know that there are over 200 of different terpenes per variety of cannabis flower, and these terpenes contribute to the different tastes and scents. They play a huge role on the effect of each strain of cannabis, and these terpenes work synergistically with the cannabinoids to produce the entourage effect, which gives the different strains their unique therapeutic effect. And that is why a certain strain works in a certain way and a certain strain works in another way. Besides interacting with the cannabinoids and synergizing the therapeutic effect, they also interact directly with dopamine and serotonin receptors, and they have their own effect by, for example, boosting the antioxidant effects of THC, enhancing the effects of CBD, and also other therapeutic effects. So what are the disadvantages of having 4 products available to prescribe to patients? What happens is that when a patient is on a certain strain of cannabis flower for months and even years, a tolerance develops, and the patient would need to increase the dose of THC to get the same therapeutic effect. Even though the patient increases dose of THC, the therapeutic effect is still reduced with time. These are observations that we've seen in our patients since we've started prescribing cannabinoids in 2018. And what happens is when they increase the dose of THC, they get side effects which are related to increased consumption of THC, such as memory problems, for example, feeling tired during the day, maybe. Vaporizing is not always suitable for all patients, so some patients may resort to unapproved products, or they might even make their own medicine at home. And sometimes when products are out of stock, the patients end up without having the medicine that was prescribed to them. Also, having a limited range means that suppliers usually have higher prices. So what can we do to help patients to get better control over their symptoms, to get consistent control, and to have better medicines for patients to be able to target every type of patient and every type of condition? So first of all, we need different methods of delivery. So besides the flower, we also need oils, and we also need edibles, and we also need topicals to be able to offer the patient a wider choice that is more likely to help them manage their symptoms. We need different strains of cannabis flower because since vaporizing is one of the most popular ways of consuming medical cannabis, and because the terpene profiles of the different cannabis flowers helps to provide a variety of therapeutic effects in patients, we would like to have a wider range of cannabis flowers to be able to help more patients relieve their symptoms more effectively. Patients who cannot buy the medicine ideally should be allowed to self-medicate, and perhaps they could also have more affordable options by licensed producers to be able to help every patient have their right to self-medicate with this indispensable medicine. So I thank you, and I invite you to contact me if you have any questions or would like to discuss anything we saw today.